प्रोसीजर है प्रोसीजर ऑन सिजेरियन सेक्शन। तो सबसे पहले हम सिजेरियन सेक्शन इसके हम इंट्रोडक्शन देखेंगे। एन ऑपरेटिव प्रोसीजर दैट इज़ कैरिड out under anesthesia whereby the fetus, placenta and membranes are delivered through an incision in abdominal wall and the uterus, usually carried out after viability has been reached, that is 24 to 48 weeks of gestation onwards. Definition is key. It is an operative procedure whereby the fetus after the end of 20th week is delivered through an incision on the abdominal and uterine walls. Indications are maternal and fetal. मैटरनल में आएगा कंट्रैक्टेड पेल्विस, पेल्विक ट्यूमर्स, एंटीपार्टम हेमरेजेस, हाइपरसेंसिटिव डिसऑर्डर्स, प्रीवियस LSCS, abnormal यूट्राइन एक्शन, हिस्ट्री ऑफ पुपीरियल इन्फेक्शन। फीटल में आएगा माल प्रेजेंटेशन, फीटल डिस्ट्रेस, डायबिटीज मेलाइटिस एंड बैड ऑब्स्टेट्रिक हिस्ट्री। इसकी कॉन्ट्रा इंडिकेशंस हैं सीवियर एक्सीडेंटल हेमरेज, एक्सटेंसिव स्कार, pyogenic infection in the abdomen wall, example in burns, dead fetus, the baby is too premature, presence of coagulation disorders. Types हैं इसकी इलेक्टिव एंड इमरजेंसी। इलेक्टिव में the operation is done at pre-selected time before onset of labor. It is usually done around 30th week of gestation or term. Emergency में the operation is done due to any complications arising either during pregnancy or delivery during labor. Types of operation आएंगी lower segmental cesarean section and upper segmental cesarean section. LSCS में आएगा it is, in this operation the extraction of baby is done through an incision made in the lower segment through transperitoneal approach. In this a transverse incision is made in the lower segment of uterus. It can be done after about 32 weeks of gestation. Advantages है इसकी the lower segment scan heals well because during the puerperal period the lower segment is not active and upper segment which continues to contract. The risk of puerperal sepsis is minimized. USAs में आएगा in this baby is extracted through an incision made in upper segment of uterus. Is rarely performed. Operation is done only under forced circumstances such as carcinoma of cervix, big fibroid in lower segment, constriction ring, lower segment is difficult और इसकी example placenta previa adhesion due to previous abdominal operation. Equipment आएंगे इसके extra drape sheet, towels, receiving pack for baby, C-section tray, delivery forceps, cord clamp, basin set, blades, neonatal receiving unit and self-contained oxygen. ID band, suction, bulb syringe, solution, sutures. Procedure देखेंगे हम इसका. The operation most commonly carried out is the lower segment cesarean section. The lower segment incision is in the less muscular and active part of the uterus and heals better. The main reason for preferring the lower uterine segment technique is reduced incidence of descent pregnancy. The abdomen is open and the loose folds of the peritoneum over the anterior aspects of the lower segment and above the bladder is incised. The operation continues to incise this suture to visualize the fundus of bladder which is then pushed down and away from the surgeon. The surgeon directs the fetal head out while the assistant applies fundal pressure to hit the delivery of the baby. Oxytocin may be given by the anesthetic list after delivery of the baby and clamping the cord. When the baby and placental have been delivered, the uterus is sutured. This is usually done in 2 layers. Peritoneum then be closed over uterine cavity. The rectus sheet is chased, thin the layers of fat, and finally skin is sutured. When the surgeon's choice of materials, commonly visceral or braided polyglutine preparations is used for this. Nursing management है इसकी. Pre-operative management. Patient should be physically prepared, that is abdomen, back, private parts and upper part of thigh are shaved and cleaned. Prepare mother psychological by providing assurance and explaining the incidence, procedure and need of cesarean section. Administration of IV fluid of 50% dextrose To avoid hypotension following spinal anesthesia, the infection line is maintained patient by an extravenous cannula. Blood grouped and cross-matched for emergency requirement. Blood should be empty by inserting Foley catheter. This may be done before and after induction of anesthesia. Mother should be in NPO for about 8 hours. Patient should be in calm down. Valuable ornaments should be taken off and all makeup should be removed. If elective cesarean section, then ranitidine 150 should be given orally in the night before and repeated 1 hour before surgery to prevent gastric pH. Postoperative care and immediate care 4 to 6 hours. In the immediate recovery period, the blood pressure is recorded every 2 hourly. The wound must be inspected half hourly to detect any blood loss. The lochia are inspected and drainage should be small initially. Following general anesthesia, the woman is nursed in left lateral or recovery position unit. She is fully conscious. Analgesic is given prescribed. First 24 hours. IV fluid or continued blood transfusion is helpful in anemic mothers. Parental antibiotic is usually given for first 48 hours. Analgesic is the form of pethidine 75 to 100 mg are given as needed. Ambulation is encouraged following day of surgery and baby is given to mother. After 24 hours, TPR are usually checked after 4 hours. Orally feeding is started with clear liquid and then advanced to normal diet, and IV fluid are continued for about 48 hours. Catheter may be removed on following day when the woman able to get up to the toilet. She should help to get out the bed. The mother must be encouraged to take rest and provide care to the baby and should breastfeed the baby. Complications है इसकी मदर की shock related to blood loss, anesthesia, hazard, sepsis, secondary PPH, thrombolysis, lung infection past. Late complication में आएगा menstrual irregularity, chronic pelvic pain, backache. Fetus में आएगा latrogenic prematurity, respiratory distress syndrome, injury of baby due to surgical knife, birth asphyxia due to anesthesia. And इसकी बाइब्लोग्राफी है सेठी नीरज टेक्स्ट बुक ऑफ midwifery and gynecological edition 3rd page number 44 to 445 www.nursing.com and www.wikipedia.com. हमारा प्रोसीजर है प्रोसीजर ऑन सीजेरियन सेक्शन.